$45,000 a year. That's what one family is spending on health insurance. And they still can't afford to go to the doctor. Let that sink in for a second. $45,000. That's more than the median individual income in the United States. And at the end of it all, this family is skipping care, deferring appointments, and paying hundreds of dollars out of pocket every single time one of their kids gets sick. This is not a story about an uninsured family struggling to get by. This is a story about a fully insured, working American family with employer-sponsored coverage who are being absolutely crushed by a system that was supposed to protect them. If you've ever felt like health insurance in this country is a scam, this video is going to make you feel very seen and very angry. So let's talk about what's actually happening out here, because most people have no idea how broken this truly is until it happens to them. Here's what the average person thinks health insurance works like. You pay your monthly premium, you go to the doctor, you show your card, you pay a small copay, maybe $20, maybe $40, and you walk out the door. Insurance covers the rest. That's the promise, right? That's what we're all sold. You pay in, you're protected. Simple. But the reality for tens of millions of Americans looks nothing like that. And the story we're breaking down today is one of the clearest, most painful examples of exactly how far the gap is between the promise of health insurance and the actual lived experience of having it. This comes from a real account shared online by a mother of two. She and her husband have 4 people in their family to cover. Her husband gets insurance through his employer, and she is not offered coverage through her own job, which is incredibly common, so they have no choice. They go on the employer plan. Now, here's where the numbers start getting wild. They pay $12,000 a year in premiums out of pocket. $12,000. That's $1,000 a month, just leaving their bank account before anyone has seen a single doctor. But wait, her husband's employer is also kicking in $33,000 per year toward that same plan. So the total cost of this insurance policy is $45,000 annually for one family. That money is being paid to an insurance company every single year. And in return, this family gets, well, let's talk about what they actually get. They have a $5,000 deductible. That means before their insurance pays for almost anything, they have to spend $5,000 out of their own pocket first. And here's the devastating part. They have never hit that deductible. Not once. And the mother even notes in her story, luckily with a question mark, because she's in this impossible psychological position where she genuinely doesn't know if it's good news that they haven't been sick enough to rack up $5,000 in medical bills. That's what this system does to people. It makes you feel grateful for not getting sick instead of protected if you do. So what does this family actually get for their $45,000 per year? Each person gets 1 annual wellness visit covered. That's it. A couple of cancer screenings considered preventative. If any of them actually get sick, like sick enough to need to see a doctor, the visit costs $190 out of pocket every time. If you need a specialist, anywhere from $250 to $500 per visit out of pocket. There are no low copays. There are no affordable prescription benefits. There's none of the coverage that they apparently once had under an ACA Marketplace plan, which they specifically mention having before. Think about that. An Affordable Care Act plan gave this family better day-to-day coverage than this employer-sponsored plan that costs $45,000 a year. But the part of this story that really stopped me, the part that I think is going to hit hardest for a lot of parents watching this, is what's happening with their child. One of their kids is on a medication, and because of the nature of that medication, the law requires that the child attend monthly medication management appointments. These aren't optional, they're legally mandated. So every single month, this family has to take their child to a 5-minute appointment. And I want to be clear, this mother specifically says 5 minutes. That costs $150 every month. And the medication itself is another $50 per month. So just for this one child's legally required care, they are spending $200 every single month. That's $2,400 a year. on top of the $12,000 in premiums, on top of whatever else they're paying out of pocket for other visits and prescriptions, all while carrying a $5,000 deductible that their insurance won't do anything meaningful until they cross. And what is the emotional result of all this? This mother and her husband are deferring their own medical care. They are skipping the doctor. They are deciding not to go when something is wrong because they cannot afford it. These are insured people, people who are doing everything right by society's standards, working jobs, carrying insurance, paying their premiums, and they are still rationing their own health care because the math simply does not work. She ends her post with this line: "It's unfortunate that we pay so much for coverage and can't use it." And then she says, "The healthcare industry and health insurance are irreparably broken in this country." Irreparably broken. Those are heavy words, and I don't think she's wrong. Here's what this story exposes that I want you to really understand, because there are some structural things happening here that most people don't fully grasp. First, employer-sponsored insurance is not the gold standard it's marketed as. For decades, we've been told that getting insurance through your job is the best-case scenario. It's considered a major perk, a sign of a good employer, something to be grateful for. And for some people, it genuinely is good coverage. But for millions of families, especially those with 4 or more people to cover, the employer plan is expensive, restrictive, and barely usable. Employers shop for plans based on what's affordable for the company, not what's best for the employee's family. And the employee often has no other option. Second, high-deductible health plans have become standard, and they are brutal for anyone who doesn't have significant savings. A $5,000 deductible sounds manageable in theory until you realize that most American families cannot cover a $500 unexpected expense without stress, let alone $5,000. High-deductible plans keep premiums slightly lower on paper, but they transfer almost all the financial risk onto the patient. The insurance company collects the premium. The patient absorbs the cost. It's a great deal for the insurance company. Third, there's a profound and maddening gap between what insurance costs and what it actually does. $45,000 per year, and this family still pays $190 every time they're sick. That is not insurance in any meaningful sense. That is a very expensive permission slip to maybe get help if things get catastrophic enough. And fourth, the people who suffer most under this system are often not the poorest or the richest. They're the people in the middle. Too much income to qualify for Medicaid or significant ACA subsidies. Not wealthy enough to absorb high out-of-pocket costs without sacrificing other things. Working people, parents, people who are trying. So what can you actually do with any of this? Because I don't want to just leave you angry. I want to leave you with something useful. If you are in open enrollment right now or coming up on it, do not assume your employer's default plan is your best option. Run the actual numbers. Take your expected medical usage for the year, add your premiums, add your likely out-of-pocket costs under each plan, and compare them honestly. Sometimes a slightly higher premium plan with lower cost sharing saves you money. Sometimes it doesn't, but you won't know unless you do the math. Look into whether your employer offers an HSA, a health savings account, alongside a high-deductible plan. The tax advantages of an HSA are real, and building that account over time can help bridge the gap when you actually need care. If you are self-employed or your employer doesn't offer coverage, don't dismiss the ACA marketplace automatically. Depending on your income, subsidies may make marketplace plans significantly more affordable than you expect. And as this family's story illustrates, marketplace plans aren't necessarily worse than employer plans. Advocate. Talk about this. Share stories like this one. The reason this system persists is partly because people are embarrassed to talk about medical debt, deferring care, or struggling with insurance. The shame is misplaced. The system is the problem, not the people trying to navigate it. And if you have the ability to contact your elected representatives, use it. These are policy choices. They can be changed. Other countries have figured this out. This is not an unsolvable problem. It's a political will problem. If any of this sounds familiar, if you've sat in a waiting room calculating whether you can afford the visit you're about to have, if you've skipped a prescription because of the cost, if you've felt that sick feeling of paying $1,000 a month in premiums and still coming out of pocket every time you need care, you are not alone. This is happening to millions of people right now. And most of them think it's just them, that they're doing something wrong, that they're not working hard enough or choosing the right plan. You're not doing anything wrong. The system is doing something wrong. If this video gave you something, whether it was validation, information, or just the relief of knowing someone is saying what you've been thinking, hit subscribe. We dig into stories like this every week. Real situations where real people are being failed by systems that were supposed to help them. And we break down what's actually going on and what you can do about it. Your situation deserves to be understood, and this channel is here to help you understand it.